You're just starting out in cash physical therapy, there's only 3 metrics that you need to be targeting in order to be able to quickly acquire patients, to replace your salary, and to give yourself the momentum and the month-over-month growth to be confident enough to go all in on your practice. Number 1, it's your conversions. You got to know that you can convert a prospect when they contact you into a patient. And so we want to be able to hit 80% conversion rate from evaluation into our plans of care or our packages. Once we are hitting that conversion rate, the next one we want to solve for is our lead nurturing. Of the leads who are coming in, are we actually able to generate sales conversations as a result of that? And so we want 80% of all phone calls to turn into booked evaluations. So that's the next problem you want to solve for. The third involves your lead acquisition. Are we able to acquire patients at a profitable level? Because whoever can pay the most to acquire a lead is going to win 9 times out of 10 because they can just outspend everybody with paid advertising. We want to be able to acquire a patient at $100 or less. And if you're able to do those 3 things, convert 80% of evals into packages, convert 80% of phone calls into paid evaluations, and acquire patients at $100 or less, you are unstoppable. And now you can just fuel that marketing funnel, and then you can start solving for your fulfillment, providing a world-class experience, and then for retention, trying to get to a $2,000 patient lifetime value where patients are sticking around longer, they're paying you more so that you don't have to focus so much on acquisition.